Welcome to the Healing Grove podcast. I'm Dr. Kristen Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. I'm Dr. Kristen Ryman, your host, and I'm so delighted today to introduce you to my new friend, Dr. Debra Muth. She's a nurse practitioner, a naturopathic doctor, and a certified functional medicine specialist with expertise, deep expertise in regenerative medicine and basically problem-solving complex mystery illness. As the founder of Serenity Health Care Center, she brings hope and solutions to her patients, many of whom have spent years suffering from complex, chronic, mystery illness symptoms and, the unfortunate side effect of those symptoms, which often can be multiple misdiagnoses, lots of gaslighting, and certainly isolation and despair. And like so many who I interview on this podcast, Dr. Deb came to this work because she experienced her own set of terrifying symptoms and harrowing journey through the medical system, and not only lived to tell about it, but has recovered a new level of vibrant wellness that allows her to share what she's learned with everyone else, which is why she agreed to be on my podcast. So thanks, Dr. Deb, for being here.
Oh, thank you for having me.
Yeah. And if this is the first time you guys have heard her story, I think it's going to blow you away because she basically recovered herself from something that we're all told isn't recoverable, which was MS. And she healed from that and is going to share some tools for how she did that. And since that recovery, she's continued to see patients, has also felt moved to share what she's learned in larger ways with a larger audience through her book, Seen It Last, which is about to relaunch. That's exciting. On her podcast, which is called Let's Talk Wellness Now, and now has over 250 episodes, I think, on that podcast.
Yeah.
So awesome. And also in a new venture that she's about to launch, that involves AI, and we're going to hear more about it because I am just obsessed with this idea, and I think it's going to change the world, frankly, for people who have these kind of mystery symptoms and mystery illnesses. So we'll get into that. But let's start with your story, if you don't mind. I'd love to hear you tell kind of where it all began, and since you were a patient for that chapter, I'll ask you to start where I ask all my patients to start, which is tell me the last time you were 100% of your own personal rock star best, and then what happened after that.
Yeah, I would say I felt my 100% best rock star before all of this happened. It was pre-COVID. Like we define everything, right? Pre-COVID and after COVID. And I thought I was doing amazing. As we define amazing, right? I was working about 50 hours a week. I have multiple businesses. I have 8 businesses that I run. I have my family. I have all these things, these patients that we take care of. We take care of 15,000 patients in my practice, and I love it. And I thrive on all of that. And then COVID hit, and I got sick with COVID in the beginning, no big deal. And about a year after I had COVID, I started getting these unusual symptoms. I'd feel like somebody was brushing a feather across my face, and then it would come across my thigh, and then it would go across the other leg down the shin. And I was like, oh, this is kind of weird. And you're busy, you don't think about it. I just kind of kept going about my business. And then I started recognizing that I didn't remember my protocols that I've used for 20 years. All of a sudden, I'm forgetting, like, what's the name of that supplement? How do I prescribe this? What am I doing? And I thought, oh, I'm depending on the computer a little bit too much. We've got the EHR, I've got everything templated. And then I started becoming very irritable. I was not somebody that anybody would want to be around. I faked it a lot with my patients, didn't fake it with my staff, and I'm so grateful that they're all still with me. They got the wrath of most of it. And then I started getting these migraines that were so debilitating, I could barely function. And I started thinking, okay, something else is going on. And I have a bad neck. I have a lot of degeneration from some injuries in my neck. And I thought, okay, numbness, tingling, brain, all of this, headaches, irritability. I'm tired. I hurt. I don't feel well. I'm going to go see my orthopedic doctor. So I did that. And as I was telling him this story, he's kind of looking at me and he says, Deb, you're a smart woman. He's like, you know what's going on. And I'm like, yeah, my neck is really bad. And unfortunately, I think it's time for us to do some intervention. And he said, no. He's like, I think you have MS. And I kind of sat back and I went, what? I'm like, no, you're crazy. This is not MS. And then it flashed me back to when I was 28 years old. I had very similar symptoms and did a bunch of research at the time. I was a new NP. I was 28. I didn't know much. And I went to my doctor going, I'm coming out with a diagnosis of either fibromyalgia or MS. I knew that much. I came out with a diagnosis of fibro and told to go home and prepare to be disabled in 4 years. Here's a prescription for narcotics. Here's a prescription for antidepressants.
At
And
28,
I can't believe we do
that
that
was at 28 was
at
when you felt,
28.
wow.
And so luckily I had my friends that did wacky medicine back then that is now all very acceptable functional medicine. And they walked me through that path and I was healthy for a very long time. So I'm thinking, okay, here we go again. And we kind of joked a little bit about doing this brain MRI. And I said, fine, I'll do it, but this is not what's going on. And 3 days before Christmas, he called me and said, Deb, your brain MRI shows that you have white matter disease, you have MS. And I said, well, I'm looking at the same brain MRI and it says it could be Lyme, it could be toxins, it could be in mold, it could be this. He's like, you don't have any of those. I said, but I did have Lyme and I did have an exposure to mold. And he's like, no, 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 it's not that. It's MS. He's like, I really want you to go see somebody. You're young, get on medications, and you're going to be fine. And I said, thank you, but no thank you. In my world, MS is all of these other things until proven otherwise. And he encouraged me again, please do this. And I said, no. And I didn't see anybody for 2 years after my diagnosis. I didn't see a neurologist. I didn't see anybody. I decided to put my head down and do what I did for all of my patients. And I'm like, okay, this is my brain. I got to figure this out. And I started digging around to see like what triggers MS besides infections, because I already knew about the infection piece. And I did all my labs. And sure enough, I came back with 5 tick-borne diseases that were all active. And I didn't have any symptoms until COVID hit. And then my mold markers were off the chart. I had HHV6, chlamydia pneumoniae. I had all these viruses, and I was just a toxic mess, right? And so I started treating all of those things, but I knew there was other things that were missing in the world of MS. So I started saying, okay, what other things have happened to me in my life that could be related to MS that we don't ever think about? Traumatic brain injury. Don't ever think about it. I had 3 traumatic brain injuries, 2 concussions, and I thought, okay, maybe this is part of this issue as well. And did some work with Dr. Mark Gordon, who is an amazing traumatic brain injury trainer. He works a lot with the military vets that have been injured and started learning from him what he teaches these vets and what he puts the vets through. And started doing all of that and realized my prefrontal lobe was shut down. I did a SPECT scan to really see what my brain was doing besides just an MRI. And then I explored different options for treating myself, antibiotics, ozone, phoscholine IVs. I did some brain retraining. I did something called prehag to calm my prefrontal lobe down so it wasn't hot all the time. And 18 months later, I had absolutely no symptoms. And even better yet, I had reversal of the white matter disease and I grew my gray matter of my brain by 1.5 deviations, which is unheard of.
Yeah, well, it's unheard of in sort of standard medical circles.
Yeah.
It's the kind of thing that people in our world, right, in sort of functional medicine
Mhm.
land and alternative medicine, integrative medicine, we're looking for root causes, and so we're finding root
Right.
causes, and then when you get rid of
Yeah.
the root cause, the rest of it goes away. So
Mhm.
I think it would help people listening and wondering, like there might be people out there who say, "Oh my gosh, I'm having similar symptoms," or "Wow, I just got a diagnosis of MS and was told the same thing. Where can I get this SPECT scan? Where can I get this phosphatidylcholine IV?" And I want people to know that these are not standard therapies that your regular trained
Mhm.
doctor will know about. They're not things I learned in medical school, right? I don't even
Right.
think some of them are things you learned in naturopathic medical school. Like it's
Right.
some of them are pretty cutting edge because when you have an illness like this, when you have a label like MS and the symptoms that come along with it, it's pretty high stakes. And so, you have to do some more extreme things. However, they're all things that could be found with people who do the kind of work that you and I do. So
Mhm.
how did you did it all for yourself? Did you work with any practitioners? Like who was on your healing team besides you, yourself, and you?
Yeah. So I did most of it myself. I have a couple of colleague friends that I consulted with too. But then I really went into people that I didn't know at all and said, okay, I need some help here. So when I started sharing my story with some of my colleagues, I was luckily enough for them to say, hey, you need to talk to this person. So I actually saw a doc in New Zealand who was a brain specialist, and she kind of kept turning me on to new and different people. She turned me on to Dr. Goodenow, who's Alzheimer's brain specialist. I didn't know anything about him when I started, and got involved with his program and did his research for MS and learned a ton from him and did something called Plasmalogens. Um, and then I had another colleague of mine who actually said, Deb, I think you need to do some spiritual healing as well. There's trauma behind this as well. And we need to see how much of this is happening from you or how much of this has happened because of the trauma that your mom and her mom and her mom had while they were pregnant that passed down from the genetic line. And I'm okay with all that kind of stuff. A lot of people wouldn't be, but I was totally fine with it. And I did some of that work as well and got to figure out like this is what you own in your life that happened because of your trauma, but this is what's happening because of their trauma. And let's try to break this trend. And so I did a lot of spiritual trauma work as well. And I'd say that's probably where I got involved the most with other practitioners. All the infection things, the mold things I've been dealing with patients for 25 years. So I was really comfortable doing that on my own. I did talk to a couple of people in my group with Dr. Neil Nathan and Dr. Jill Christa. They're both friends of mine. And we kind of shot back some ideas in our group about things and learned a little bit more then about vagus nerve stimulators. And those kinds of things weren't really that popular 4 years ago. So I started playing with some of that. And then I dug into a lot of the research and just did the research of functional medicine to say what works for this. And as I uncovered each piece of things that I had, I went back to the literature to say what works and what doesn't. And then I started playing not just with myself, but I started implementing some of these things with some of my patients to see if it works for me, can it work for them as well?
Yeah, I mean that's what I was going to get to next is this journey I'm sure has brought some new tools and mindset
Mhm.
shifts that you're in a perfect position to incorporate with people who really need them. As you look back on this journey, what are the pieces? Like I always think it's really important to, at each step in the journey, as you're making these little, I mean, what amounts to little mini experiments on yourself, right? With your little N of one experiment, to look back and say, wow, that either worked, that didn't work, I'm not sure. That seemed to hurt, not help, like making those micro decisions kind of based off of your experience. And as you look back, I'm curious to know which of the things you felt were a total waste of time, if you know, and which of the things you felt were that was really instrumental?
Yeah. I kept a journal through this whole time because I wanted to be able to see objectively what worked and what didn't for me as well. And I would say one of the first things I started with was NAD IVs because they were so popular and everyone said, oh my God, they're so great for the brain. I did not feel that way at all. I hated them. I hated every time I did them. I got so sick. And my staff would laugh at me and say, we told you not to do it so fast. And I was like, I don't even think it's that. Like, this is just, I was so sick from them. So I didn't do very many of them. I did a couple. I think the phosphatidylcholine IVs made a huge difference for me. And now that I understand the research behind what they actually do to the brain, I understand it was growing my gray matter, and I was really getting a lot of that in there. I did 12 months of IV antibiotics for Lyme until my tick-borne disease was negative. And I literally did almost a full 16 months in conjunction with that of mold treatment. When I was doing the mold treatment, they found a golf ball size fungal ball in my nasal passages, which was totally by accident, right? We did the brain MRI and then they found something in my sinus cavity. And then I saw the ENT who dismissed everything and tried to tell me it was a dental implant that caused the issue. And I knew when I saw it, I was like, no, this is mold. And so I flew out and I saw Dr. Donald Dennis in Atlanta, who said, yeah, you've got a fungal ball. You're your own mold factory. Hands down, that made the most difference for me. Within 24 hours of having sinus surgery to remove the fungal ball, all my neurological symptoms were gone.
So, the fungus ball is so interesting to me, and I think a lot of people actually are colonized with mold and don't know it, right? Like they're
Yes.
living in mold. The mold move. If you live in the mold long enough, I always say the mold moves into you, and you become the sick building, right? But at what point do you feel like all of this started for you? Because you mentioned feeling great before this happened, but then back in your 20s, late 20s, you had these symptoms that basically could have gotten you a diagnosis of fibromyalgia if you'd wanted it and disability if you'd wanted it.
Yeah.
Do you think you had Lyme and mold going the whole time and sort of simmering, and then there was some kind of straw that broke the camel's back?
I do. I remember a tick bite, and I remember saying to the doctor, I had a tick bite. I had this rash. She's like, oh no, don't worry about it. And it was about 6 to 7 months before I had the diagnosis of fibromyalgia.
Yeah.
And I was living in a house that had black mold. It would grow up the closet and, we'd clean it up and you did whatever, and it wasn't a big deal. And when I moved out of that house, oh my God, I felt so much better. And I didn't realize anything back then about mold. And my kids were better because they were having problems with ear infections and ADHD diagnoses. And my daughter would wake up with these swollen eyes all the time when we were in that house. And within a couple of weeks of moving out of that house, all of us were fine. And so I think I got mold back then and probably never completely got rid of it. And then I remodeled a riverfront cottage. And as we were peeling things away there, we found more mold. And I thought at that point I was knowledgeable about mold. And I was like, okay, this is a problem. And I made sure I was detoxing. We were using all the appropriate things, but I think I never really truly got rid of it. And I think Lyme was just always simmering there. And I never completely treated before until it was completely gone. I think I did a couple of rounds. Oh, yeah, I'm feeling good. Okay, I'll stop. It's all right. But I don't think I ever really totally got rid of it. And then I remember getting sick when we had traveled outside of the country and coming back and not feeling well for a couple of weeks. And then things got better again. And then if I think back truly after that, things kind of just always were not perfect, but they were acceptable, but they weren't perfect. And I just kept thinking, it's age. I'm working a lot. I'm not sleeping very well. Just those normal things. And now when I look back at the whole history of things, I'm like, oh yeah, that timeline was very telltale.
Hmm.
And we know that untreated Lyme leads to MS in a lot of cases. It mimics MS, and you get the white matter brain disease, and you get a lot of the neurological symptoms. And people get diagnosed with MS and don't have lesions and don't have monoclonal bands, but they're told they have MS. And in my opinion, that's probably not truly MS. It's probably some tick-borne disease or some kind of toxin instead that's causing those symptoms to occur.
Well, do you think there's such thing at all as a pure MS without some kind of root cause?
I don't think so.
Yeah. I mean, why would that be? Why
Right.
would that be?
To me, the body's not that stupid. It's just not going to start attacking the brain tissue for no reason. But I think years ago when we thought the blood-brain barrier was so pristine and nothing pierced the veil, it was easy for us to think that. But now that we know bacteria and pathogens and things like that get across that blood-brain barrier, it's impossible to not think that something is toxic in the brain and causing the immune system to attack the toxin that's there. And unfortunately, it's attacking the tissue along with it.
Yeah. Yeah. So, before we leave the topic of your story, I'm really curious about something you told me earlier, which was that the most important thing in your healing was the mindset shift.
Yeah.
I wonder if you'd be willing to tell us about that mindset shift.
Yeah, absolutely. So I was raised in a household that was quite negative, not traumatic or anything like that, but everybody just complained all the time about everything, and I love my mother. She's 86, but she still finds the negative in everything. So it was very classic for me to kind of be that same person, to always look at the glass half empty. And so when I got sick, I realized that part of this healing journey was going to have to go back and look at some of the trauma that happened in my life. As a young woman, we all have trauma. and deal with some of those things and start to look at how do I change my own mindset? If I'm going to have to live in a body that doesn't function well, I have two choices. I can be the victim and say, poor me, look at my life, or I can say, excuse my language, but screw this. I'm not going to live like this. And that was the place where I took. I said, I'm not going to live like this. Nobody's going to tell me that I have to take these drugs that are going to cause cancer and all these other problems, and that I'm going to end up in a wheelchair and I'm going to be miserable. And I'm going to have people doting over me, and I'm not going to do that. So I went from that stance of saying, I have power over all of this, and I can choose how to do this. And first and foremost for me, I chose that I wasn't going to accept the diagnosis. I wasn't going to let the diagnosis become me. This is something they see. Yep, it's white matter disease. I'm not calling it MS. It's white matter disease. I've got an inflammatory process. I need to fix it. Plain and simple. I'll figure it out. And then on top of it, I said, I have to lose this negative attitude. And I was raised as a Christian, and love God, all of that, but got a little disenchanted by the whole religion thing as I got older and walked away from the church for a whole lot of reasons. And I said, you know what? I have to get back to my spirituality. I don't have to do it the way everybody else is doing it, but I have to get back to some spiritual belief and some spiritual practice. Because if I don't have a belief that's higher than me, I don't know how I'm going to get through this. And so that's what I started to embark on. I started reaching out to people who understood the spiritual world and could help me find a way back to my God and my Christ in a way that felt good for me instead of a way that felt institutionalized and all about religious monetization and all of that that I didn't like about religion, but that I truly, for the first time in my life, had a relationship with God and Jesus and the spiritual world in a different way. And so as I started to do that, I started to be able to release a lot of the trauma that I had as a woman growing up, and started to heal. And then I started embarking on people who would say, do you really think this is yours, or do you think this belongs to somebody else in your lineage? And I started learning about the lineal trauma that happens to us, and worked with some people that knew how to reach that spiritual realm, and realized that there were a lot of things that I was carrying in my life that didn't belong to me. That, I had a grandmother that was raised during the Depression. They starved. I had ancestors that came from different countries that had really difficult paths that I knew about because I did some genealogy for fun. And when I looked at all their lives, I saw the trauma in their lives and the negativity and how it just kept bleeding into my life. And I was like, okay, I need to stop this because I don't want to pass this on to the rest of my kids either. And so that's where I started doing a lot of deep spiritual work to change who I was and how I looked at the world.
Beautiful. Do you have any, I mean, I think it's such an important topic, and a lot of people don't sort of have an opportunity to think in this way, right? To think about the epigenetic insult, the physiological manifestation of generations
Yeah.
past. Do you have any simple tools for either beginning that path, like resources, or even just releasing stuff that you identify that you're like, yeah, I know I'm carrying that from my, my matriarchal lineage or my
Mhm.
dad's side of the family. Like, what do you have that you could share with us around that?
Yeah. So some of the things that really helped me the most was being able to get in touch with me and my own intuition. And there's a ton of free things on YouTube that you can do. I did a lot of YouTube videos for free where I started doing brain retraining. And I would just listen to trying to tap into the different sides of my brain and letting things go. I love meditation, but I can't meditate. I can't quiet my mind without my mind thinking all the time. So I would use YouTube and I would go in and say, okay, I need a meditation thing, but you need to tell me a story. Because if I have a story being told to me, my brain's not thinking about 100 other things at the same time. And so I did a lot of those different frequency things that were free. And I would just find things that I liked. Some of them I didn't like, some of them I did. Some I liked with music, some I liked with stories. And I would encourage people use those resources. They're free. Just look at different meditations to retrain your brain. And then I did some negativity ones that were free because I would do them when I couldn't sleep at night. I didn't sleep for more than 2 or 3 hours a night when I was sick. And I was like, I have to get some sleep. And I would turn these things on and I would just let my brain just kind of go. And the frequency healing for me was really helpful. And I think that's what made a big difference in calming my nervous system down. That was before we had vagus nerve stimulators and things like that that were super popular and good. But they're inexpensive to do and it works. It really works to calm your body down.
Oh, I love that so much. I've never thought about just sort of surfing through YouTube to find things that resonate
Mhm.
and I'm sure now with AI, it's going to get so much easier for people to
Oh,
kind of
yeah.
really tailor things to their own
Hmm.
predicament, which brings us maybe to your new platform. Tell us about
Yeah.
your new platform.
Yeah. So let's talk about Venaari. I love Venaari and people always ask me, where did you get that name? And Venaari is kind of a made up name, but the two parts of the name means warrior and healer. And so since that was my journey, I it resonated with me and it's just kind of a fun, different name, right? So, what I've learned in 25 years of practice is from practitioners and patients, we're all struggling to get information and get correct information. I've trained a lot of practitioners over the years, and they spend hundreds of thousands of dollars learning functional medicine, but still don't know functional medicine. We have to do it to learn it, to understand it. And you've been trained as a medical doctor. I've been trained as a traditional nurse practitioner. I honestly think functional medicine probably is more complicated than what you and I went through for conventional medicine because there's so many different avenues and so many different things, and you can only learn so much at one time. And if you're a practitioner working for 25 years, that's great. You've had a lot of long time to learn. But if you're a new practitioner, you still don't know enough to help every person that sits in front of you. And if you're a patient, you're going to ChatGPT these days to try to find information. But ChatGPT, remember, doesn't go out to the internet, it stays confined. And so you're getting information that ChatGPT has been trained on, and it's not always the correct information. So I wanted a platform where people could utilize AI, but have AI trained in the true functional medicine world. So I literally took everything that I've ever been trained on and we used all of our patient data of protocols and what we did to people for the last 25 years, what we did to move lab tests and what lab tests we ordered, all of that. And we trained an LLM, so a learning model, language learning model, on all of the functional medicine. So our app is very similar to ChatGPT. You go in and you type in a question and it spits out an answer. For a patient, it's going to give you a different answer because it's going to give you a layperson instruction. So it comes in a language that you can understand. For a practitioner, it's going to use our language of what we use, but it's also going to give you an entire protocol of lab tests to do and different peptides and exosomes and supplements you can do and diagnoses and all of that kind of thing. So if you're finding yourself in a place where you have something in front of you, you don't know what's going on, you can use this to say, okay, help me figure out what to do and what protocol do I use? And it'll populate like that for you.
Wow, it's gonna be huge. I mean, there's so many applications here, and I can imagine people listening and being sort of like inspired and hopeful because it right now, I mean, you can get sort of similar. So the current way to do this, right? If you're not in some kind of a membership that has an AI bot or a
Hmm.
representation for the doctor or practitioner running it, you can go to chat and you can say, chat, pretend you are,
Yes.
Debra Muth, pretend you're Kristen Ryman, pretend you're Neil Nathan,
Hmm.
Neil Krista, and tell me how you would answer this question. And sometimes it's close, sometimes it's really
Hmm.
close, and sometimes it's just completely made up. But what
Right.
you're saying is what you're doing is you're creating this large language model. Is it large language model or LLM?
Yep.
You're
Mhm.
creating the platform and the repository from which this model draws very specifically and carefully so that it's not going to hallucinate and give you a bunch of slop.
Exactly. And right now, what if you do that with chat, the only thing chat has to give you the answer is things that you and I have said publicly already. So if
Right.
we haven't said these things publicly, it doesn't know how to find it or how to put it together. In our LLM that we're doing, you're literally getting everything that was in my brain that I put into this. So I put into everything in writing and we put it in there. And so you get not just me, but you get all the beautiful brains that I've trained with because we've taken all of that education that I've had for the last 25 years and trained this model with that too. So you're getting Neil Nathan and Jill Krista and Mark Gordon and Dr. Amen and Dr. Perlmutter and Dr. Heyman. And so all these people that I've trained with over the years and learned things from through and from, that has all gotten fed into this model as well, so that you're getting all of our brains together.
Amazing. It's amazing. I can't wait to see it.
Yeah, it's so exciting. I'm really excited because the other thing I think that's gotten hard, and practitioners and other people might hate me for this, but functional medicine has gotten so expensive
Yeah.
and people can't afford it. And I wanted a way that people who couldn't afford working one-on-one with somebody could still get functional medicine and get it in a way that could help them and maybe help reduce the costs for them or keep it at a level where maybe they don't have to pay the practitioner so often or for such a length of time, to make it more available to the masses. Because right now it's getting to the point where we're really capturing a group of people who are financially better off to get functional medicine. And I didn't want to see that happen forever.
Yeah, no, it really is democratizing and beautiful. And it's going to make practitioners work easier as well because,
Yes.
rather than it's cheaper for patients, but it's also less time consuming for practitioners to say things
Mhm.
again and again or to really give a lot of details on things that they could just look into the model and learn for themselves.
Exactly.
Beautiful. Well, I can't wait. I want to sign up right away for that. Um, I want to talk about mitochondria for a second. I know it's a bit of a departure,
Yeah.
but you mentioned several times in the past to me that mitochondria are an important piece of recovery, and it's not something we've ever actually talked about in the Healing Grove podcast. So I wonder if you wouldn't mind just kind of introducing the audience to these friendly little minions that we have everywhere in all the
Yeah.
cells of our body, and kind of how they relate to complex chronic illness.
Absolutely. So I think the word mitochondria just kind of frightens people sometimes because it's such a big word, but it really is just a big word for cell structure, right? We can simplify it that much. And the problem with chronic illness is it damages these cells, sometimes to a place where they don't function at all. And sometimes it makes it very difficult for them to recover as well. And so when we're always in this place of let's kill, let's kill, let's kill, and not repair and restore, we have a problem. But the mitochondria is the center of all of that healing. And so we have to make sure that when we're healing somebody, we are focusing on building and restoring their cell structure so that it's healthy. Otherwise, if you think about it, if you're a visual person, think of a shriveled up cell versus a big, buoyant, plump cell. And we want that big, buoyant, plump cell to be healthy to give us everything we need. And when we're sick, it's more shriveled up. It doesn't have what it needs. And so once we repair the mitochondria and those cells work better, then the body in general works better. And Dr. Goodenow talks a lot about this with autistic kids and how the big part of what's going on in the autistic world is their mitochondria being damaged. Their cells were damaged from the beginning, from whatever insult caused that. And if we don't work to repair that cell and get it healthy, that person will never become healthy then. And so there's some basic things that we can do, like B vitamins are really important, glutathione is really important, vitamin C, CoQ10, phosphocholine. These are all nutrients that we can use to help improve the cell structure. So if you have a good foundation, then everything else you do can be helpful. It's kind of like having a solid foundation for your house, and then you build on top of that. Well, we need to be doing that in these chronically ill people because their cells have been so damaged.
Yeah. I'm curious to know if plasmalogens, which played a role in your recovery, are being used by you now in your patient population.
They are. And when I learned about plasmalogens, I was probably about 14 months into my recovery. And I would say plasmalogens made a huge difference for me. It was a big turnaround for the neurological symptoms. I was still having a lot of neurological symptoms, even though a lot of my tests were starting to look normal. And when I added plasmalogens, I would say it probably took me about 2 weeks after being on plasmalogens. All my numbness and tingling went away. And I was like, okay, this is interesting. Is this just in my head? So I stopped them for a week and they came back instantly. And then I started it again. And every time I did that, thinking it's not these plasmalogens, it did the same thing. And I was on in part of the study with Dr. Goodnow. So we did a brain MRI that showed my brain loss. And about 8 months later, after being on plasmalogens, we did the brain MRI again. And that's when I had the 1.5 growth of my gray matter within 8 months of being on plasmalogens.
Wow. Was that a specific to MS study, or was that kind of a generalized, let's look at plasmalogens and what they do in the brain?
He was running an MS study at that time, and he had a bunch of us in there. There was only a couple of us in MS, but then he was also had a lot of different practitioners in there and doing the same thing with their brains to see could we replicate what he did with his brain. And every one of us had improvement of our brain. But the MS piece was really great. I mean, he has another patient who had lost her vision from MS. And it took about a year of being on plasmalogens, but she started to regain her vision again. And she can actually see shapes and colors now for the first time in about 15 years.
Wow.
Yeah.
Yeah, that's going to blow some people's minds who don't
Hmm.
know that vision is regainable. Everyone thinks about
Yeah.
blindness being sort of like an end game. But
Hmm.
that's because not a lot of people are doing what he's doing and what you're doing, right? To
That's right. Hmm.
invoke neuroplasticity, put in the right nutrients, get rid of the obstacles, and it's kind
Yeah.
of the recipe right there.
Hmm.
What parts of the recipe have we not talked about that you feel would be important for others to hear before we wrap it up?
I think the other part that I used at the end, once things were getting better, and I was still like, okay, I'm good, but I want to be better yet. I started exploring exosomes and stem cells, and I almost went to Grand Cayman to have them done. And then I was like, well, I can do them here, and it's not going to cost me $1 million. And I did IV exosomes for myself, and it's not a quick fix by any means. But I noticed about a month or two later, after doing IV exosomes, that my brain really started coming back again. Like my memory was sharper again. And it wasn't just one thing, right? It's not like we're just going to do exosomes and it's going to be great. But I do think it made a big difference. And I think it has a really big play in the future here for people with neurological diseases, because we know exosomes can cross the blood-brain barrier. Stem cells can't, but exosomes can. And I think we're going to see in the future, if the FDA allows us to do a little bit more of this, I think we're going to see some turnaround in these neurological conditions with that.
So, exosomes as a therapeutic intervention is new to me. I don't know anything about it. Will you give me like the 101 real quickly? Like what exactly? I know exosomes, what they are, that they come from cells. They have, they're packaged little tidbits that the cells use to pass around, but that's kind of where my knowledge about them stops.
Yeah. So we primarily get exosomes from umbilical or placental cells. They come from donated moms. They don't come from aborted tissue. They come from donated sources. But they're like these little building blocks that can tag on to different parts of the body that are injured. So most people will recognize this, that they had a knee injection with stem cells or a joint injection with stem cells. And it's very similar to that. Exosomes are just smaller molecules than stem cells, but they tag onto all the parts of the body that are not working properly. So if we do them in an IV fashion, exosomes can actually cross the blood-brain barrier because they're small enough. Stem cells can't. If you did IV stem cells, they would go to joints and tissues and things like that. But with exosomes, we want that brain regeneration that's happening. And so it can get into that tissue and it can actually start repairing the damaged areas.
Wild. Okay. And where did you go for, I mean, you said you ended up not having to go to Grand Cayman. Did you just prescribe that for yourself, or did you find someone who was doing that?
I did. I experimented myself. So thank goodness you have a clinic like mine, right? Because we can experiment with all kinds of things. So I connected with a couple of different stem cell companies and found what I felt was a really pure product. Learned from Dr. Scott Martin, who is out of Las Vegas. And we started learning different protocols, and I started playing with the different protocols on myself. Learned a little bit from what Grand Cayman was doing, which I had already done quite a bit of for a year before that. And so then we just administered the IV in the office and kind of waited to see what would happen. And there wasn't a huge like aha, like, oh my God, this made such a big difference. But it was more gradual. It happened over about a 3 month period of time that I noticed like there's really something different happening here, and I'm not really sure what. And then after about 6 months, I repeated another IV and kind of felt the same way. It took about 3 months, but then I started noticing, wow, I'm sharper. I can remember things a little bit better. I'm not writing everything down as much. And this is really starting to help. And inside that process time is when we were doing MRIs with Dr. Goodenow. Actually, it was outside of that. I did it outside of his study. And then I repeated my own brain MRI before I decided to see the neurologist to say, do I really have MS or not? Because I kind of want to know, but not really. And we even see more improvement with my brain MRI after that. And when I saw the neurologist and she heard this whole crazy story of mine, she's like, Deb, she's like, I don't know that you ever really had MS. I think you had post-COVID peripheral neuropathy. And I went, okay, thank you.
Right. That's how she's dealing with the sort of cognitive dissonance of something that's not supposed to be healable being healed.
Mhm. Yep.
It's funny because I was telling my daughter before this conversation that I was going to talk to you. I said, "Do you have any questions for her?" And that was her question. I was going to end with that. What did her doctor say when she went back and her MRI was normal? Sounds like the doctor was like, "Oh, never mind. I told you you'd be disabled for life. Oops, my bad. I was wrong. It was just a little COVID." Wow.
Yep. Just a little COVID.
Wow.
And we know COVID triggers MS in people. 5% of the people, there's a small study, there's actually about three small studies, all containing less than about 10 people, but every one of them had triggered MS either after the vaccine or after the illness. And so we know there's some kind of, you know, uh, connection there. We're just not sure quite yet what that is, or will it be a permanent thing, or did they have it before and it just happened to be in conjunction? But there definitely is a connection there of some kind.
Yeah. Well, it makes sense to me knowing what the spike protein does to kind of blood vessels and to blood
Mhm.
clotting and to all the different things that can stir up biofilm. If you've got
Yeah.
Lyme in there already, why wouldn't it be the roto-rooter that pulls up your Lyme and then makes your Lyme active?
Yep. Exactly.
Yeah. Well, wow. It's an incredible story. And I'm so happy that you knew what tools to use or you knew what questions to ask and you
Mhm.
were determined and persistent and were able to make a recovery. It's an amazing story.
Yeah. Thank you. Thank you. I mean, I was lucky because I knew, and I don't ever want a person to not be in that position where they don't know. So we created a free Facebook group called Seen at Last. And so anybody who feels like they have never been seen or heard in the medical community, which is going to be primarily women, but the men are allowed in too. If you just want a community of people that have been through what you've been through, you want to talk to people, I drop in there every so often and do lives. I drop in there with some tools. But please join. It's free. We want to support everybody. We want to help each other out. I don't ever want somebody to have to go through the conversation that I went through and said, here's the answer, and you don't have any other choices to recover, because that isn't true. We can recover. Can I recover everybody? No. Can anybody? No. But we have tools to make things better, and you don't have to live that life if you don't want to.
It's a great message, and I'm really grateful that you're willing to share it with us today. Thank you.
Thank you.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.